Welcome back. So it's called Integrated Refugee and Immigrant Services. And in New Haven, they held a pop-up health clinic over the weekend.
That's right. There, refugee children could get a health examination that's required to enroll in school. NBC Connecticut's Jane Caffrey shows us how this event meets an ongoing need.
It's a head-to-toe physical that refugee children who arrive to the United States must take per law before they can enroll in school. But recently in Connecticut, there was a backlog of students waiting to get that exam. It's why Integrated Refugee and Immigrant Services, or IRIS, hosted a pop-up healthcare fair over the weekend.
That was a big relief,
Rona Robar, a nurse and healthcare interpreter, grew up in Afghanistan and Pakistan before coming to the U.S. and having the same health exam 2 decades ago as a teenager.
I'm glad that I was able to get to where I am today.
And Shafiullah Fazi was a physician in Afghanistan before he was forced to leave 2 years ago.
I speak the languages and I serve my own community, people from all over the world, and I feel really great.
Both now putting their skills to use to organize the clinic Saturday, where 6 refugee families received care and 21 kids got the required physical to enroll in school.
You'll be off to school before you know it.
These providers with Fairhaven Community Healthcare were just some of many who volunteered their time.
I just wanted to be here to help support.
Feeling the pop-up clinic was crucial since they regularly provide care for refugee families.
The children are so resilient and they're a joy to work with.
They also saw firsthand the uptick in refugee resettlement last fall that drove up demand for the kids' physical exams. IRIS has been struggling to make appointments for every new student in 2024.
Ideally, we see these children within 30 days up to about 90 days. But due to the high numbers of children coming to resettle in New Haven for the last several months, we had started to having longer wait times.
But thanks to the health fair over the weekend, the backlog was cleared. At IRIS, the health coordinators say more providers statewide need to get on board to meet this ongoing need for children resettling in Connecticut.
Hopefully we can find more partners, for the future.
Yeah.
For Robar, the effort strikes a chord on a personal level. As a little girl, she didn't have access to education under Taliban rule in Afghanistan until her family later moved to Pakistan.
I was 12-year-old and I was enrolled in first grade. I completed 2 grades per year.
How does it feel for you, having come here as a refugee yourself, to now be giving back to these other kids and making sure they can do that health assessment to get into school?
It gives me so much comfort that I'm here and I'm able to help them, guide them, and get them ready for school.
In New Haven, Jane Caffrey, NBC Connecticut News.
When you hear what people go through in a place like Afghanistan, it makes you realize how blessed we are to live in this country.
It's true. And the kids, they need all the help they can get.
Yeah, and the reality is it's not just refugees, it's everybody. Health care is a major issue in this country right now.
Important.